So the first session was on Friday. This was an extended educational session, and there are actually 2 chapters in the educational book that I would encourage those of you interested in global health to read. The first was an invited piece about the history of the non-communicable diseases, or NCD, movement that led to the UN political declaration for NCDs and has culminated just a week ago in Geneva, Switzerland, with the World Health Assembly cancer resolution being passed by all member states. So it's an exciting time in global oncology. The other chapter in the book is about global partnerships for cancer control. And this was the theme of the educational session on Friday. Dr. Peter Yu introduced the session and gave an overview of the Global Oncology Leadership Task Force, as well as all the interesting opportunities for people to engage with ASCO on the international stage. He spoke about partnerships, he spoke about ASCO University, and the opportunities for volunteers to get more involved. Now, ASCO membership is growing all the time, as I understand it, and there are more than half of the members outside of the US now. So I would encourage you to look at the website. I believe the slides will be posted, and we can have more about that later. The second session was by Dr. Sana Al-Sakoun, who's from the University of Jordan, and she gave a superb discussion and overview of what we really need to work together towards reducing the global cancer burden. Now, there's no one person or one agency who can do this, but I encourage you to look later. She, I hope, will be interviewed later on eCancer TV, and she will discuss in much more detail what she presented on Friday. It was mostly about the different elements that have to be brought together in order to really make a difference. For example, if you have equipment and infrastructure but lack human resource capacity, you're not going to get very far. And these things may sound like motherhood and apple pie, but actually putting them together in this context and getting us all in the room to really think about how we can strategize to bridge those gaps was very fruitful. There was a good Q&A afterwards as well. The next session was by Dr. Mary Gospodarowicz, who, as you know, is formerly president of the UICC, the Union for International Cancer Control, and she spoke about the challenges of bringing new technologies to low and middle income countries for cancer. The specific example that she highlighted was about radiotherapy, which is her special area of expertise, and she led the radiotherapy task force while president of UICC. I would encourage you to look at the Lancet Oncology summary of that report. The third talk was by Dr. Gilberto Lopez, who many of you know, and he gave a very heartfelt and poignant discussion of the problems of access to new treatments. He gave actually his own family story, and I'm sure you'll be hearing more about that either on eCancer TV or in print through ASCO Connection. And finally, I gave an overview of the World Health Organization and the other UN agencies' role in global cancer control. In particular, I mentioned the different UN agencies that work with the World Health Organization, such as the IAEA, the International Atomic Energy Agency, and IARC, the International Agency for Research on Cancer, which is the WHO's specialized agency for cancer research based in Lyon, France. These three communities of scientists and public health experts have been coming together for many years, but in particular now are working towards helping countries at a member state's request to develop and actually implement and mobilize resources for their national cancer control plan and their national cancer control strategy. Together, these three agencies also partnered with 4 other UN agencies for the cervical cancer Global Joint Program for Cervical Cancer Prevention and Control. And that includes UNAIDS, because as many of you may know, if you're HIV positive, you're much more likely to develop and die of invasive cervical cancer. So UNAIDS is a pivotal part of this organization, as is UNICEF, because let's face it, we're talking about children and young adolescents who really are the ones who need HPV vaccines the most. Also UN Women, who have an important political role, in particular advocating for women's health and rights and equality for women. And lastly is UNFPA, last but not least, the UN Population Fund, who are actually the administrative agents for this UN Global Joint Program for Cervical Cancer. So stay tuned for more about that. The updates are that the program has been able to complete several missions for the first phase of 6 countries to assist the governments in working with civil society, and this is where the partnerships come in. Communities like yours, whether you're an ASCO member, you have academic affiliation, you may be an individual practitioner with an interest in global health, you might be a public health scientist who happens to be checking out eCancer TV. The whole point is to try to bring everyone together, because it really does take more than a village to make an impact in global oncology. And so I ended by mentioning a bit about the history of the UN process that led to the declaration, political declaration at the high-level meeting on NCDs in September 2011 that led to the Global Action Plan for Non-Communicable Diseases and the target to reduce premature mortality from NCDs by 25% by 2025, and finally with the World Health Assembly passing of the Cancer Resolution, which was just a week ago. So we'll keep you posted on this. I encourage you to look at the World Health Organization website also for updates.